The next question is, can psoriasis cause arthritis? Yes, psoriasis can cause arthritis. There is a type of arthritis called as psoriatic arthritis. And as psoriasis begins as a dandruff, a small trivial symptoms that is called as a dandruff. Nobody cares about it, but gradually it spreads on the skin, elbows, knees, it can spread on the whole body, and it can also affect the nails. It doesn't stop affecting the nails, but almost 50% of the patient who have psoriasis, they get a type of arthritis called as a psoriatic arthritis, where there is a swelling of their joints, especially the small joints, and that is called as psoriatic arthritis. In psoriatic arthritis, especially if it is not properly treated or not diagnosed earlier, it can cause a deformity of your fingers, permanent deformity, and the joints will be lost and the fingers can get deformed permanently. So this is possible in psoriasis patients, and almost 50% of the patient can get that type of psoriatic arthritis. One should be aware of the arthritis in psoriasis, and there are some signs you can know it that arthritis, you are getting affected by arthritis. So initially when the psoriasis patients notice that the arthritis begin, the symptoms are they get heaviness in the body or stiffness in the body in the morning. So after they do the exercise, gradually the stiffness goes. Then there is stiffness in the joints in the morning, especially the finger joints or back. And as soon as they move on, it goes away better by motion. But later on, the joints get swelling. We notice that when the swelling of joints in psoriatic arthritis, it is like a sausage-like swellings. So this sausage-like swelling is a typical diagnostic of psoriatic arthritis, especially of the finger joints or the joints of the toes. They are the first to affect by psoriatic arthritis. Or there are many times one single joint swelling, one knee is getting swelling. So that may be also one of the diagnostic feature of beginning of psoriatic arthritis. So when the psoriatic arthritis begins, so there is a swelling and you cannot move the joints, and if you do not take the treatment for a long time, or if you don't take proper treatment, you can lose the joint. They get fused and there's a deformity. So number one thing, whenever one knows that he has a psoriatic arthritis, he has to go on moving the joints. If you move, you can save them. The treatment will take time, but during the treatment or before you get, as much as movement you can do, even a little movement will help you, but go on moving the joints. So you can treat that. Especially you have to diagnose it earlier. The next important thing I will say that whenever there is a psoriasis and there are chances of getting psoriatic arthritis or there are signs of psoriatic arthritis, I always ask my patients to avoid heavy weight lifting or exercises that are weight bearing or jumping or all these things, running. You stop it. Have a mild exercise, not weight bearing exercise. So weight bearing exercise can damage your joints. So in case of psoriatic arthritis, take care. Early diagnosis is the best prevention for psoriatic arthritis, but if it is not diagnosed early or not treated well, you can lose your joints and there can be deformity. So be careful for psoriatic arthritis. Thank you.